Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. After my second cancer treatment, I used to suffer from chronic pain, migraine, headache, fatigue before I invented ASTR's specialty. If you are Take charge of your health today by signing up for one of ASTR's free online treatment programs. Just click the link on the screen. To become a patient or to purchase ASTR tools, click the link on the screen. If you would like to become a certified ASTR provider, click the link on the screen. So, Derek, tell me a little bit about yourself, where you practice, how long you've been practicing.
I've been a physical therapist for almost 20 years. I've done outpatient, inpatient. I used to work for Kaiser for about 12 years, and then I went into my own practice. And now I'm doing both my own practice, private, and I do home health physical therapy.
So for like 20 years you said around?
For about 20 years.
So in those 20 years, what kind of manual technique you integrate or classes you've been taking as a physical therapist?
Over the years, I went to a few courses. I took a few courses. You know, I took a manual course, a manual mobilization course.
Joint mobilization?
Joint mobilization, soft tissue mobilization, a whole bunch of like electrotherapy courses,
modalities
massage,
and
and different just you know, any type of modalities.
So now you took the online course and you came one day for the hands-on training.
Yes.
So can you give me a feedback? What do you think about the online course and the hands-on training?
Yeah, I really love the online course because I'm a very busy physical therapist, and I didn't even know if I would have time to
come to the
class. To be honest, so I was glad you offered the online course, and it took me a while to finish the course, but
because you're busy. Yeah.
I'm busy.
Yeah.
But what I really liked about it was I was able to digest a lot of the information and even practice on my patients. And I was so amazed at how well the method is, you know.
So you've been taking the course for a while.
Yes.
Okay. How long you been practicing ASTR on patient after taking the online course, before the hands-on, and what result you getting?
Well, what happened was I started watching the videos, and I would watch your own videos on YouTube, and I would just like, every patient I get, I would watch a video on the area that I was going to treat, and then I would just do the technique, and I was just amazed. They would actually say they're better, you know. And then I just finished the course like a few months ago.
So do you remember any case that stood out for you when you used ASTR on?
There was a few.
Okay.
I would say I had a 30-year-old female with chronic back pain.
Okay.
And she said that she would always just feel pain throughout the day.
Okay.
And I did like the ergonomic assessment, and I found out like she would be on the computer for hours at a time. So I did ASTR on her back, and in just one treatment, she was so surprised, you know, how well the method was in alleviating her pain.
Yeah. So can you see the difference between ASTR and what you used before?
Oh, it's night and day.
So can you tell the average discharge before ASTR and after ASTR? Like how many sessions do you usually see? You used to see a patient before to get them some kind of relief, and how many treatment now with ASTR?
I would say typically before ASTR, I would be seeing patients for like at least 2 months, 2 to 3 months at a time. And I wouldn't even get the results that I'm getting with ASTR in just less than five visits.
5 visits. Yeah, that's your average. Yeah, yeah, that's nice. Yeah. So.